Hi guys, so
Hi.
welcome back to our channel All Round Health Talk. In this video we're going to conclude with syphilis, which as you all know is a sexually transmitted infection. So in our last video we talked about syphilis, the concept, the bacteria that causes syphilis, the symptoms you're supposed to look out for, the risk factors. And so in this video we're just going to conclude and talk about diagnosis, treatment and prevention of syphilis.
Now, how do we diagnose syphilis? Syphilis is diagnosed by first doing a blood test. Now, this blood test is done to look out for antibodies against the bacteria that causes syphilis. Now, these antibodies are antibodies that actually your body produces to try to fight the infection, and these antibodies stay in your blood for a long period of time. It could even stay up to years. So these antibodies help to diagnose both recent and previous infections of syphilis. So that's the first way that they can diagnose syphilis. The second is by doing a spinal tap. Now, they do this through a procedure that is called a lumbar puncture. What do? They get the fluid that flows between your spinal cord and your brain, and they try to see if they can detect the bacteria in that fluid. Now, this would actually be positive if you're already in the tertiary stage of syphilis, but that's one way that you can diagnose syphilis. Another way you can diagnose syphilis is by getting a swab from the fluid or the ulcer that is called the chancres, which was the first manifestation of syphilis. So they try to get the fluid or they try to get a swab from that ulcer in order to test it to see if they can actually detect the bacteria that causes syphilis. So, and then coupled with the symptoms that you present. So when you go to the doctor, he'll try to correlate all this information and then finally give you a diagnosis for syphilis.
So what do we do to treat syphilis? Generally, as we know, syphilis is caused by bacteria, so treatment will be with an antibiotics. Generally, penicillins are used to treat syphilis. Now, apart from the treatment, the doctor is going to do a follow-up testing after the first 3 months, then 6 months, and then 12 months if it's necessary, to see how you're reacting to the medication, if there's actually effect, if the medication is actually having effect on you. And then another thing we can do as part of the treatment is to repeat the treatment in a case where after taking the treatment you still present symptoms of active syphilis. In this case, your doctor would have to do a repeat of the treatment. Also, patients who have syphilis have to undergo treatment with cardiologists and neurologists in the case of tertiary syphilis, when there's affectation of the brain and the heart and other organs. Based on what organs are affected, you would have to do treatment with various specialists. Another part of the treatment would be for the pregnant women. Now, if you're a pregnant woman who has syphilis, you would have to receive the penicillin during the whole period of pregnancy, and even after pregnancy they will still have to continue do a follow-up on you. Now, you have to take the penicillin during the course of pregnancy to reduce the risk of your baby coming out with a congenital syphilis. There's possibility that the baby will come out with a congenital syphilis, but if the woman is treated with penicillin during pregnancy, the risk of getting congenital syphilis reduces greatly. So that's also important. But in the case where your child comes out with congenital syphilis, your child will also have to be treated with a penicillin after birth, and would also have to go through follow-up testing after treatment. All the women who have syphilis, their children have to be, even if they've received penicillin during the course of the pregnancy, the children have to undergo thorough physical examination at birth and continuous testing for the first month, the second month, and the third month. because whatever antibody of the syphilis that they get from the parent is going to be in their system until 3 months. After 3 months, it disappears. So that's why they need to do those checkups and continuous testing for 3 months. Apart from treatment, we also want to talk about prevention. How can we prevent syphilis? We've been talking about sexually transmitted infections, and basically they have the same prevention method. So promiscuity is supposed to be a risk factor, which means we have to try to live a faithful life, I guess. Be faithful to your partner, stop going around. It will reduce your risk of getting syphilis. Use protection when you're having sex with your partners. Whatever form of sex you want to have, please try to use protection. If you can abstain from sex, which is a very, very good method of protecting yourself from this disease. Also, for women, it is important for you to do your antenatal checkups, because if you have antenatal care, any STI is going to be detected on time, and then the prevention could be done to avoid your baby from coming out with the disease. And then lastly, regular checkups. Like we said, you can have latent syphilis that doesn't show any symptoms. So for you to be able to diagnose that, you have to be someone who goes for regular checkups. So let's just try to take care of our health, take care of ourselves, so that we can enjoy the life we want. Let's just try to take care of ourselves so that we can enjoy our lives and accomplish all that we want to accomplish. So yeah, this is what we have for you on syphilis.
Yeah. So I hope you guys enjoyed the video, and I hope you also learned a lot from the video. So please don't forget to like, subscribe, share to others, and drop your comments and your questions, of course, because we're looking forward to getting your questions and we're looking forward to answering them. So please don't forget to do that. If you want to know the different ways that you can send us your questions, go to our Instagram page at Oral Health Talk. You can follow us, we'll follow right back, and then you can know
Follow.
Yeah, you can know the different ways that you can send us your questions. So like, you guys take care and have a nice weekend. See you.
Happy New Year.
Yes, exactly. Happy New Year. Bye.
Have a wonderful 2019.